Thanks for coming out to the University of Michigan Health Informatics Learning Showcase presentation. I'm going to buzz through my slides very quickly because the main focus of our presentation is to highlight our current MHI students. So as a brief introduction, my name is Annie Nill, and I'm the Recruiting and Admissions Coordinator for the Health Informatics Graduate Program at U of M. We are a 52-credit master's program spread over 4 semesters or 2 years in Ann Arbor, Michigan. And we have a quick video that I want to show you to start off with, highlighting the key points of being a health informatics student at the University of Michigan. So to highlight some of the key things about the University of Michigan Health Informatics program, I'd like to start off with our phenomenal faculty. Our core faculty are listed here, and we boast a 1-to-5 student to faculty ratio with our 11 core faculty members. Our faculty are some of the best in the world. They've held executive positions at the U.S. Department of Health and Human Services. They develop optimal methods for transforming health data into meaningful information for end users, be it patients, clinicians, or health officials. And they work on large-scale text mining, analysis, and natural language processing. To highlight some of their key achievements, I've pulled a little bit of information about one of our faculty members, Associate Professor Tiffany Vino. Tiffany is helping kidney dialysis patients have healthier treatment sessions through a new $6.7 million project at the University of Michigan. The project educates both patients and their medical teams on how to make dialysis sessions safer. The study is unique in that it's a clinical trial comparing the effectiveness of 2 educational approaches, peer mentoring and provider education. The second reason to get excited about the University of Michigan Health Informatics Graduate Program are our outstanding students. I'm going to highlight a couple key factors about our students. 14% of them have an incoming clinical degree, be it an MD, nursing, or pharmacy background, and our average GPA is 3.47. Audrey Goulding is one of our current students. She is a part-time student who also works full-time in the program, and one of her really exciting projects that she was a former member of is the kidney paired donation project, where she matches living kidney donors with people who need kidneys, one of the only organ match organizations in the country that doesn't come out of tragedy, one of the people having to die in order to become an organ donor. So she gets to use health data in a way that's very meaningful, gets to save lives within this organization. It's very neat. Another reason to get excited about the Health Informatics program is our global reach. We offer the Global Information Engagement program that features opportunities for students to travel internationally. 2 years ago, our students went to India, and this past year they went to South Africa. They're going to be going to South Africa again this year. Some of the projects that they've worked on include the Mobile Maternal Child Care Program and Elder Connect, which helps children of patients with Alzheimer's and dementia in India connect with providers and information on how best to serve their parents and help them stay healthy and stay active in their community. We have very enviable employment outcomes. 100% of our students are employed within 6 months of graduation. Even more impressive, 75% of those students secured their employment before they graduated. They knew where that first paycheck was going to be coming from when they walked across the stage. And our average starting salary is $75,000 a year in the first year after graduating. One of the main features of the University of Michigan Health Informatics program is that we have a unique partnership between two schools. We are the only joint graduate degree on campus at U of M. We're housed under both our School of Information and our School of Public Health. So it's a really unique organization. This offers a very interdisciplinary opportunity for our students, and they get a really deep dive into both the data analytics, HCI, and UX experience within the School of Information, and a very robust curriculum from our School of Public Health. We have quite a few areas of study, including consumer health informatics, clinical informatics, healthcare data analytics, health IT, and population informatics. So plenty of opportunities for people to spread their wings and learn more about the HI realm. And for good measure, we've also highlighted some of our key takeaway points. We were cited as one of the top 10 great grad programs in public health by Brain Gain magazine. We're the #1 information school in the country based on US News and World Reports, the #1 public research university in the United States. And at this point, I'd like to transition over to our #1 students. We have Dane Jacobson here, who's a first-year MHI student. He'll be presenting first, and then Shrishti Agrawal is going to be presenting after that, another first-year MHI student.
Hi, everyone. So like Annie said, my name is Dane Jacobson. I'm a first year in the MHI program. I'm going to tell you a little bit about myself, but more importantly, I'm going to tell you about why you should be interested in the talent coming out of the MHI program at Michigan. So my background is a little bit more healthcare administration and management focused. I was working. Let me tell you three reasons why I chose to come to the MHI program at Michigan. I was working for a medical group in Utah. And I started to notice a trend, and that trend was that the administrators who understand data and the tools needed to manipulate it were the ones who were advancing, and the ones who were progressing, and the ones who were poised to tackle the future of healthcare, the problems that we'll face in the future. And a lot of the meetings that I was in and a lot of the projects that I were working on revolved around this world of informatics, even from an administrative perspective. The second reason is that I have a news alert. I have a Google News alert that sends me an email every day about what's going on in healthcare. And that alert isn't specific to health IT or anything, it's just a general healthcare news alert. And when I take a look at it every day, it is dominated by data, by the Internet of Things, by these informatics topics. And so that to me was a signal that clearly that this is the direction that healthcare is moving, and I would do well to prepare myself to be a big player in this field. The third reason, I was actually, in March of this year, I was down the street at the Hyatt Regency Hotel attending a conference for the American College of Healthcare Executives. I was surrounded by these hospital and healthcare system CEOs and other administrators, and all the classes that I attended had a data component to them, and they were all trying to understand what was going to happen with the new policy, with the new regulations, with the new technologies, and trying to make sense of how to drive their organizations to be successful in the future. And at that moment, I had applied for healthcare administration programs and health informatics programs, and it was then that I decided, you know what, I need to really invest some time and learn about this world of informatics if I want to be prepared to be a leader in the future of healthcare. So that's what brought me to Michigan. I was first interested in the school because of their top-ranked health management and policy program, but I stayed interested because of their strong informatics program. So I'm now going to turn and highlight a few of our students, some of my peers. For those of you who are in the audience, we have first years who are looking for internships coming up, and if any of you are interested in having interns next year, first of all, Dane Jacobson, nice to meet you. But we also have one of my friends here. His name is Etiuwo. We call him T. He's got a little blurb about himself that I'll read verbatim. He says, "My name is Etiuwo Usoro." I hope I pronounced that right, T, if you ever watch this. I'm a first-year Master of Health Informatics graduate student at the University of Michigan. In this program, I am honing my programming, analytic, and contextual inquiry skills in the healthcare context. I have around 5 years of experience applying interdisciplinary data science techniques at various research labs. While analyzing and transforming large, highly sensitive qualitative and quantitative data sets, I gained experience in using data analysis software such as Excel, Python, Trifactor, Wrangler, and Microsoft Access. I hope to combine my leadership, collaborative, and data analysis skills with my passions for health and technology in order to contribute to projects involving healthcare information. So T represents some of our students who are a little bit more technical, but we also have students who are a little bit more focused on design. This is a second-year student named Adriana, and she is actually the president. Well, she'll tell you this in her blurb, but she's the president of our student organization. And she says, "My name is Adriana Soroki. I'm interested in making health easier through design. I am working towards a master's in health informatics at the University of Michigan with a specialization in user experience and user interaction design. I interned in user experience at Jewel Health this past summer and am president of the Health Informatics Student Organization." And she, like I said, is a second year who is seeking employment for beginning in about May. So we all have different interests, different backgrounds. If what I have to offer isn't exactly what you may need, there is somebody in the program who has that skill set. I don't plan on being a programmer, but I can program. I don't plan on being a designer, but I understand design. And it's, to me, that is important to be able to bridge the gaps and break the silos of healthcare, at least for my career that will be focused on management. Thanks.
Okay, well, thank you for being here. Really appreciate it. Thank you, Dane, for your insights and for the information that you presented on some of our colleagues. My name is Srishti. I'm a first-year student at the Michigan Health Informatics program. I come from a little bit of a different background. So I graduated 2015 with a degree in neurobiology. And neurobiology is great, right? I'm really excited about it. But as far as practical applications go, as far as applications really outside of research, there wasn't anything that really excited me. And so I joined the industry. I worked at a startup company for a year. And my experiences at that particular company really shaped and influenced my appreciation for health informatics. So I'll tell you a little bit about the company, because that'll give you a little bit of a sense of where I was coming from. We were managing chronic disease, specifically Lyme disease and chronic fatigue syndrome. Now, Lyme disease and chronic fatigue, these are two diseases that medical industry doesn't really have, or rather the medical academic community doesn't really have a proper characterization for. So we were using a lot of bioinformatics techniques to be able to pinpoint particular characteristics that patients were exhibiting to try and find out what were the actual causes of these diseases and see if we can find a correlation, right? Tell a story with the data. We were looking at metabolomic data. We were looking at proteomic data. We were looking at genomic data. And we were trying to really understand how can we form cohorts of these patients and make sense of all of this confusing data where all the symptoms are overlapping. And that was where I had my first interaction with health informatics. And that's what really got me involved and interested in this big problem. You have so much data in the world, right? And it's so hard to figure out what's important and what's not, and what's really going to be meaningful in the future. And so that's, health informatics sort of fell into my lap in that way. And from then, I met Annie, I met Kai Zhang, who was the previous director, I met Paul, who's the current director of the program, and all these amazing people who have helped shape my interests and grow my abilities to be able to understand the current industry. And so I will, that's my shameless plug about myself. And so now I'll move to introducing some of my colleagues at the program. So this is Brian Chen. Brian Chen has spent 15 years as a doctor in internal medicine. He's coming to the program with a wealth of clinical experience. And in particular, Brian is really interested in alleviating the stressors of how clinicians interact with electronic health records. He's in particular actually come up with a really impressive idea to improve the patient experience and the clinician experience in inpatient clinic settings and small clinical environments. What I mean by that is basically he's formed a way to streamline the way that we intake patients, the way that doctors read the patient data and combine the family history, and then the way that doctors can then create informed decisions from one clinical interaction. And that project, his entire entrepreneurial project, is called Epiphany, and he has actually just come back a couple weeks ago from pitching that startup opportunity to a big VC in New York. So he's on his way with that. And so he's really interested in policy management. He's interested in entrepreneurship, digital health, and all as it relates to customizing and really revamping the experience of patient and provider interactions in small healthcare settings. So that's Brian. And then we have Ahmad. Ahmad is an amazing individual that I've had the chance to interact with. He's also sort of in the startup environment as well. Bit of good news, he has experience in medical physiology. He actually transferred from the graduate program in medical physiology to health informatics. And he is now actually working with the Cancer Center at the University of Michigan, and he's developed a way to revamp the experience that patients have with managing chemotherapy and going through the process of, he's interacted with the patients, he's developed a team of clinicians and of practitioners who are helping him to make an informed clinical experience for both the provider and the patient. And he's actually just last week, I think, gained approval from the hospital administration to do piloting and initial data collection to make sure that his plan for alleviating some of these concerns that chemotherapy patients have is actually a robust one. So, like Dane and I have sort of given you an idea of, the people who are in our program come from very different backgrounds. They come from very different places and very different areas of expertise. And as far as being able to, synthesize and understand different aspects of the industry and combine that into one collective experience, that's really what this program is about. And that's the sense that I've gotten so far as a first-year student. So I'm really looking forward to going into my second year and learning even more about health informatics and doing that with the University of Michigan. So, thank you. And I think Annie's coming back up.
At this point, are there any questions about the University of Michigan Health Informatics program? Outstanding. Well, thank you very much for attending today. We really appreciate your time and attention, and go Blue!